Good afternoon to all of you. I am Dr. Silly Sridharan, Professor in Pathology. Today I am assigned with a PA number 7.1 and we have to start with a new chapter in neoplasia. So to start with, I need you people to know that February 4th, that is 2 days before, was celebrated as World Cancer Day, and the theme for the World Cancer Day was close the care gap. Everyone requires the access to cancer care, indicating that each person in India should be made accessible to any kind of cancer treatment which they can afford to. So moving on from the topic, the leading cancer in women, and the data in 2022 says that in India, among the females, the most common leading cancer is now breast cancer, and then comes oral cancer, and then CA cervix. Now let's step back 10 years back, and when we look into the same kind of data 10 years back, CA cervix was the one which was leading the chamber. Now why CA cervix has come down from first position to the third position is basically because of the extensive screening that we are actually taking in. So there is extensive screening of CA cervix at the very preliminary level so that we can detect cancer at the very initial stage. Now CA breast has become leading cancer is basically because of our changing lifestyle. We have slowly moved on from a developing country to a developed country. Our food habits have slowly changed from a regular diet containing a lot of food which contains green leafy vegetables, fiber rich diet, to a diet which is more of fast food kind, which all predisposes to CA breast. So my class today is core topic PA 7.1, dealing with neoplasia. It's going to be an interactive lecture. Sorry. Now my SLOs are: specific learning objective for today's classes to define neoplasia, describe general characteristics of neoplasia, classify neoplasia, and the last of the lot would be to make you aware of the common terminologies that we use for neoplasia. So let's start. All of you must be aware of a department which is slowly teamed up high, that is oncology department. Now what does oncology department mean? Onco means tumor, OG means study. So we are basically dealing with a department that deals with study of tumors, and that's one of the sub-subjects or subtopics that we deal in pathology, where we as pathologists deal with the diagnosis of cancer. So where does this term oncology or cancer arise from? Cancer basically arises from the terminology crab-like. How crab has its claws going on to the adjacent tissue, the same way a tumor or a cancer spreads to adjacent tissue with invasive or irregular borders. That's how cancer is very similar, or cancer's symbol is crab. Now according to a British, let's move on to the next SL, that's my definition of neoplasia. According to Willis, neoplasia is abnormal mass of tissue of the growth which exceeds and is uncoordinated compared to that of a normal tissue, and it persists in the same manner even if the stimuli which started the reaction is removed. So let's look at the key words in diagnosis. In the definition: exceeds, abnormal, uncoordinated, and excessive, which persists in the same manner even after you remove the stimulus which started the change. So basically, in short, the definition in short, or crux of the definition, is an abnormal purposeless growth that preys on the host and is virtually autonomous. That means it's not under control of any tumor, any signals. The same thing here, which I would like to emphasize: neoplasia is uncontrolled or not controlled by any signals. It's irreversible. That's something that you all need to understand. Once we classify something as cancer, it's irreversible, means it cannot go back. That's the difference between neoplasia and something that we've already taught you before in cell adaptation as hyperplasia. or hypertrophy. These changes are reversible, whereas in neoplasia, this uncoordinated mass is irreversible and it's self-perpetuating and multiply continuously. Once it reaches on to the cell cycle, it can never go back. It just keeps on multiplying. So the tumor, which is abnormal, keeps on multiplying to form a bigger mass. Now let's get into two basic terminologies that we use in oncology, or something that we commonly use in pathology that you need to clearly understand or delineate. One is called benign, another one is called malignant. Now what is benign? When we say benign tumor, we are basically meaning a mass of a tissue which is basically harmless, okay, and that is less harmful, whereas malignant tissue means we are basically meaning cancer in a layman's term. So what is, and that cancer is usually most of the time is harmful, fatal, depending on the treatment. Now once this difference is clear, let me put into note one more statement, that benign tumors, though they are harmless, there are places they become fatal. That depends on the location of the tumor. Like in case of sella turcica is a small space that you see in the skull where pituitary gland is situated. Now that space is basically a 0.5 centimeter dip. Now if you have a tumor, though benign in nature, that means a harmless tumor, but just above that pituitary you have something called optic nerve. Now even though that optic nerve, which is responsible for giving us sight, is situated over it, if you have a tumor that is, though benign, is sitting over it, it tends to compress it. So though I said benign tumors are less harmful, but just because of its location, it's compressing on the optic chiasma, causing blindness. So there are exceptions to any rule. Now moving on to what do you see in the microscopy in case of a neoplasm. You have two basic components. One is the parenchymal component, another one is the supporting stroma. Now the simple thing that you need to understand is that parenchyma is the epithelium and stroma is something that connects this epithelium, and this stroma contains blood vessel, some inflammatory cells, some nourishment which the tissue requires for growth is carried by this blood vessel and fibroblast. So let's look at the picture. The picture shows that there is, now this is the epithelium, the parenchyma, and this is the stroma that you see. So the two basic components of neoplasm. Now moving on to terminology, so nomenclature. My next SLO. What is OMA? Now the moment we use the term called OMA, it means something benign. So that if a tumor that is arising from fibroblast is called fibroma. If it's arising from chondrocytes, it's called chondroma. If it's arising from osteocyte, it's called osteoma. If it's arising from a smooth muscle, it's called leiomyoma, and if it's arising from a skeletal muscle, it's called rhabdomyoma. Now there are exceptions to this rule too. There are exceptions like melanoma. Now melanoma, though an oma comes in between, you need to know that this is a malignant tumor that is arising from a melanin containing cell. That's the melanocyte. Though oma is there, there are exceptions. Melanoma is an exception to it. Next exception is seminoma. That means a testicular tumor that is malignant. Now this is, as you can see from the picture, this is the mature cartilage, this is the mature bone. So the cartilage is called chondro, the bone is called osteo. So it's osteochondroma. These are fat cells which have this O empty space with a nucleus behind. These are benign cells, these are called lipoma. Now if the same thing, if you see a benign tumor arising from the gland, it's called adenoma, and if it has finger-like projection, it's called papilloma, and if it has cystic spaces, it's called cystadenoma. Let me show you some examples. Now this is a normal mucosa. You can see the glands here. They are quite far spaced, but look at here, this is an adenoma where there is proliferation of the glands which are closely packed. So this is an adenoma. This is finger-like projection, as I told you, papilloma, and if there is cystic space, it's called cystadenoma. Let's move on to the next terminology, which is far more popular compared to the omas that we have encountered now. It's called sarcoma. So sarcoma is any malignant tumor that arises from the soft tissue or mesenchyme. So if you have a sarcoma arising from the fibroblast, it's called fibrosarcoma. If it's something that's arising from chondrocyte, it's called chondrosarcoma. Similar way, if it's a tumor that's arising from the fat cell, it's called liposarcoma. So I hope the OMA terminology and the sarcoma terminology is pretty clear for you. OMA means benign, sarcoma means a malignancy arising from the mesenchyme. Let me show you some examples. This is the osteoid, and you can see certain dark colored angry looking spindly cells. This is called osteosarcoma as it contains osteoid, and this is the malignant component. This is fat cell, and you can see when I compare to the previous one, which was an empty vacuole, here the nucleus are looking more angry. So this is liposarcoma. Now let's move on to another terminology which you often get confused with. Carcinoma bar sarcoma. Now sarcoma is something, it's a malignant tumor that's arising from the mesenchymal tissue, whereas carcinoma is something that's arising from the epithelium. So that's carcinoma. So if you have a squamous cell lining and a carcinoma that arises from it is called squamous cell carcinoma. Example, if you have an esophagus, from the food pipe, if you see a neoplasm arising, the lining epithelium is squamous, so you have squamous cell carcinoma. That's the most common cancer that you see. If you have a tumor that's arising from the colon, now colon is lined by columnar cell, so you are expecting a columnar cell to become malignant, so that's called adenocarcinoma. Now the term adeno basically means, from adenoma means it's a benign one, adenocarcinoma means malignant one, a carcinoma that's arising from the glands. Now this is a gland, a tubular structure with a space in between, and you have this angry looking cells lining this space. So this is adenocarcinoma. Now this is squamous cells. Just think of the normal squamous cells as the histology that you have seen in anatomy, where you have benign squamous cells. Compared to that, these nucleus are very angry looking ones, and these are squamous cell carcinoma that you see in skin. Now certain terminologies are going to get a bit more complicated. You have certain tumors of mixed cell origin. That means that the tumor will show differentiation. That means it matures to form something else, though it's arising from a same germ cell. So there is basically, in a mixed tumor, there is only one germ cell. It differentiates into different cell line. Example would be a mixed tumor of salivary gland called pleomorphic adenoma. Now pleomorphic adenoma has epithelial component, it has mesenchymal component like cartilage and bone, but it's arising from a single germ cell. So this is an example of mixed tumor, or which is arising from a single germ cell layer. Now keep that in mind, and let's move on to another terminology called teratoma. Now in teratoma, what happens is that you have more than one germ cell layer. Think of a cell that comes above the germ cell, a totipotent cell which can give rise to lot of cells. So this totipotent cell will give rise to more than one germ cell, and that germ cell will produce something called teratoma. Now ask a pathologist. Teratoma is one thing that we hate to cut open because it has got a cyst, usually seen in ovary or testis, contains fat, hair, and it's containing a lot of pultaceous material to such an extent that you can even have a fetal remnant in it. The teratoma is able to regenerate any tissue that's seen in a normal human body. Now this is how a teratoma looks like, filled with hair and pultaceous material. Now this is what all the three germ cells layer that it arises from. You have an ectoderm, endoderm and a mesoderm, and you have different tissues that can be seen in teratoma, right from a mature skeletal muscle, fat, nerve, name the tissue, you can see that in teratoma. Now moving from a mixed tumor to teratoma, let's move on to another oma called hamartoma. Now hamartoma basically means it's a disorganized mass of tissue which is indigenous to the site. That means it belongs basically to that site. Let me give you an example of pulmonary chondroma. That chondroma is basically containing lung tissue, it contains cartilage, but all of them in a disorganized manner, and they form a mass called pulmonary hematoma. I'll show you a picture for that. You can see this is the lung tissue and this is this is the bronchial tissue and this is the chondroid or cartilage that you see. Next comes choristoma. Now choristoma basically means something that doesn't belong to that place and you suddenly find them. That is ectopic rest of the tissue. Now where do you find them? You can easily remember what was taught in anatomy, a Meckel's diverticulum that is situated somewhere near ileocecal junction. Now that pouch can contain pancreatic tissue, gastric tissue, anything you name of. So that's one example. Another example would be presence of pancreatic tissue in the gallbladder. Let me show you an example. This is the gallbladder mucosa. You're not expecting to see a pancreatic tissue, but you're seeing lobules of normal pancreatic tissue sitting there, and this is called heterotopia. So to summarize eventually, neoplasia is uncoordinated abnormal mass of tissue which perpetuates even after the removal of the signal. It is uncoordinated purposeless growth that you need to emphasize. Neoplasias have been classified into benign and malignant. Benign is something that's less harmful and malignant is something that's more harmful. But depending on the site, sometimes benign tumors can also pose a bit of harm. I've given you examples for that. Then certain common terminologies that you need to know is when you deal with benign tumors, the suffixes that come are omas. That means the moment you see osteoma or fibroma, think of a benign tumor. But if you start seeing sarcoma, that means it's malignancy. Carcinoma is a malignant tumor arising from the epithelium, and then I have enlisted few tumors like hematoma, choristoma. You should be able to understand what teratoma means, that it contains more than one germ cell layer, and when it's mixed tumor, it contains only one germ cell layer which differentiates into all. So with this, I end my class. Thank you all for patient listening.